some new statistics on the Ghana Health Service website that will bring your attention to about changes in our case count at the moment. I'll give you more of that, but what I do know, what I can report right now is that active, okay, so there you have it, confirmed cases now 13,203, new active cases 8,585. That's the active cases. So what we're seeing is that there's an increase of 274 new cases, and 70 people have died now, up from the previous 66 that we know. We'll do more of that as we go along. But let me just introduce you to this quick conversation about the COVID fund. It's been one of the things that have come up in the midst of concerns that have been raised about our ability to deal with this. So we're having a conversation with officials of the COVID-19 National Trust Fund. You may have heard the controversy, like I indicated earlier, about their operations. The minority even made a demand for them to render account and make public their handling of the fund. So today, we have them to tell us what's been going on there. I have here with me Kwame Bempah, who is a spokesperson for the fund. Mr. Bempah, thank you for your time this afternoon.
Thank you very much.
Are you here to render account to the Ghanaian people on what's happening of the COVID Trust Fund? How much do we have so far?
Thank you very much. We are still receiving donations from individuals and groups.
Okay.
So for now, I can give you up to last week Friday, as at the 9th of June. We have in total.
Okay, your statement here says Tuesday.
Yes,
so are you
Tuesday,
doing
sorry.
Friday or okay? So Tuesday, as of Tuesday, 9th June.
Yes, we have about 55 million cedis, 51 and some little amount being cash donations, and other items that has been donated to us, which are food and non-food items, also amounting to about 3 million. So in addition, the figure you have is what we've received now.
Okay, so the figure I have is slightly different from what you've just mentioned. So let me just mention it so we just cross-check and do the right thing.
To be accurate,
your statement, your press statement says
we have 52,281,390 cedis, 11 pesos in cash donations.
Right now?
Yes.
So that's money you have right now?
Yes, and then we have items that are not in cash. That is food and non-food items. Because it is COVID, people are donating PPEs, people are donating other items. So we have put in a value to it, and that is also about 3,228,051 cedis, 40 pesos. So the two, we add the two, and it's a total of 55 million. That is what 55 million and 59 cedis, 441 cedis and 51 pesos.
Okay, that's in terms of food and other PPEs.
Yes, so when you add the food, non-food items to the cash that we have, that is what we have as at last week. That is 9th of June 2020.
Okay. You have a breakdown of who or which institution has received what in terms of the PPEs and I believe the food items that you received.
Yes.
Okay. And it's a long list, so I wouldn't want to bore our viewers with the details of it. But how have you spent that money? The amount you just gave us, is that money sitting in the COVID fund account right now? And is it something that you haven't touched at all?
Right about when we issued this statement, we have not touched the money. Okay. But now we've started touching. The reason being that, you know, we were set up by an act of parliament. So we are mandated as to how we should disburse the monies. We don't just go out there and say that, Gifty, take this, or say, take this, Smith, take this. And by the act that established the COVID-19 Trust Fund, if you look at the objects of the fund, as in chapter, that is point 2, we are told that the objects of the fund are A, to complement the efforts of government to combat the COVID-19 pandemic by providing an avenue for well-meaning individuals, groups, and corporate bodies to contribute or donate monies and resources that may be required to combat COVID-19 And the second is to receive any other monies or resources contributed or donated to combat COVID-19. So the Act tells us who and who we should spend the monies on. And it is to support institutions who are engaged in the combat of COVID-19.
Okay.
The second group is that we should support people who have become vulnerable as a result of COVID-19. Those who are affected by COVID-19 themselves, and those who have become vulnerable as a result of COVID-19.
Okay.
So institutions, that is research centers, the frontline workers, and so on. And then we also go to people who are affected by the disease,
okay,
and those who have become vulnerable as a result of the disease.
A lot of people in this category exist now.
Yes.
Why is it that the money you've received so far hasn't been touched? It means that you have not reached out to any of these institutions so far.
We've reached to a lot. That is why I said that the contributions as they come, previously, those that were not in cash, we were just distributing. That is the list that is attached to the statement that we have. We've even given ambulances. We've given out saloon cars. We've given PPEs. We've given food and non-food items, children's homes.
I understand the bit about receiving money, receiving non-financial items that you have spread across.
Yes.
I want to focus a bit more on the
cash.
Yeah.
Initially, we've not set up our internal procurement procedures, because this Act says that we should disburse the monies according to the Financial Management Act. So we cannot just simply say that, oh, this institution has requested for A, B, C, D, so come and take it. So what we needed to do is to put in place our internal procurement mechanisms so that we will start the disbursement. Now we've done that.
Okay.
So those who have brought requests and those that we have reached out to, we've gone through the processes, and now we are buying a lot of items. We are sending out cash. For example, you know,
why are you not giving the money to the institutions directly? Why do you have to now go into the procurement?
No, those who are supposed to get money, it should go for something. So you cannot just say that you brought a request that you need so and so amount, so immediately we issue a check and give it to you. No, we need to put a cost as to what you are going to use the money for.
Okay,
because the day of accountability will come.
Because if I'm confused, the likelihood that my viewers are confused along with me is very high. What I want to understand, sir, is the money that you have. You said that you started the disbursement because you have now started the disbursement because you have now gone through the processes.
Yes, we've established our public procurement outfit.
Understood from that level. So the next step is to begin to reach out to the people who need this help and the people who have brought in requests. If someone brought you a request, if let's say Ga East Municipal brought you a request and said we needed 5,000 cedis, and
for
I'm
what?
just okay. Hang on. They say we need 5,000 cedis for let's say PPEs. Why would you want to buy the PPEs for them rather than give them the money? Isn't that micromanaging?
No, that's not what I'm saying.
Okay.
If Ga East, for example, brings a proposal and they say they need a certain quantity of PPEs, after they've supported, we ask them to provide us with pro forma invoices, and then we will also go through our procurement outfit to go and check for what we call
due diligence?
Due diligence, to see if what they have brought matches with at least what they are requesting for and what is the market price.
And from there,
then
what
when
do you
we are satisfied,
are you going to give them money? Have you given monies out already?
Yes, we're giving money out. For example, National Commission for Civic Education, you know, they are the statutory body responsible for awareness creation and education of the public. And you know, COVID-19 has a lot of education that has to go on. They brought a proposal that they wanted to embark on a national campaign, but they lack a lot of logistics.
That's because the statutory amounts that's supposed to go to that institution has not gone from government.
That one I cannot answer. Because
so they brought a proposal. I get you.
Yes.
So they brought a proposal.
So they brought that proposal that even if government, we've given them 2.5 million. As at yesterday, the check was issued. But the check was not issued in isolation because they said they needed 2.5 million and you want to give it to them. 2.5 million for what? They said they needed 20 pickups. We were able to give them 10. So we had to go around the market. What type of pickup are we saying? Is it Toyota Hilux? Is it Mitsubishi L300?
Okay, so wait, I'm still confused.
Yes.
Did you give money to the NCC to buy the cars they needed, or you went to buy the cars for the NCC?
No, they bought their own cars, but they brought the type of cars they needed.
Okay.
And they costed. And we also do due diligence to cross-check. Okay. So that when the day of accountability, like you mentioned, the minority is saying that come and provide accounts. So we just say that we gave NCC 2.5 million for what?
I get you now.
To purchase this, for this. So we've given them 10 pickups. We've given them public address systems. We've given them computers that will enable them to craft their messages so that they will go around. And then we can monitor that we gave you A, B, C, D for this, and this is what we expect that you should do. The Ghana Medical Association also said that they needed to also do an outreach program. We felt that they are a professional body with the technical know-how, so they should collaborate with NCC. They requested for 270,000. We gave them 300,000. So in addition to NCC, we have asked that the two institutions should collaborate and embark on what they are doing. We did not sit down for people to come and ask us for PPEs. We felt that PPEs are very important, and since we are also engaged in helping to combat COVID, we should buy PPEs, send them out to institutions that need them, and also to the general public. So we've taken about 8 million cedis from our money to go out there and buy PPE, supply it to institutions and others that require them. So that is how the disbursement has started, and it is going on. All
right. I think that it's still early days here, since you indicated that you have just now started touching the money. It's early days here. I would love to have another conversation with you, perhaps via Zoom, so we get more as we go along. But we understand that you have a helpline so that people who are vulnerable, who fall in the category that you've mentioned, can call you, but that line is not working.
Oh, it's not working.
Some people have sent in complaints that when they call, the calls don't get through. Are they working?
Maybe people are confusing us with the COVID-19 response team.
I hope not.
We are not the COVID-19 response team. We are the COVID-19 National Trust Fund. Our activities are different from the National COVID-19 response team. But our lines are working because even people who are voluntarily coming to give us donations, we don't call them because they just sit and we have given them their numbers. So you are there, a group or a corporate body or an individual will call. I want to make a donation to the COVID-19 National Trust Fund. Who are you? What is the name of your company? So we take their details out. We give them the days, which is Tuesday and Thursdays, and then they select the day that they want to come and do the donation. So they will come and then present us with the donation. So I would be surprised if anybody will say that our helplines are not working. Then the question is, how does people get through us to even bring us donations on their own when we are not the ones who reach them? So our lines are perfect, they work. But people should not confuse us with the COVID-19. The National COVID-19 response team is different from COVID-19 National Trust Fund.
Fair enough. Regarding those who fall within the category of vulnerable people or people who have become vulnerable because of COVID-19, I understand the category, but how do people like that, how are you able to assess people like that, and what sort of help can you give them?
You said, it is early days here, but we are not just sitting down, not doing anything. We've gone into contact with ISE. They have a research that they conduct to identify people who are vulnerable in our societies. We've taken the research outcome, we are going through, we are selecting. We've also liaised with the Ministry of Gender and Social Protection. During the lockdown, you realize that they were cooking food and they were distributing. So through them, we've taken the data and we are going through. You know, Apostle Sappho's Kantanka, they were doing their annual distribution of food and other items to needy institutions in Ghana. We've gone to them, we've taken the data. You know, there are institutions which are already needy in Ghana. Whether COVID or no COVID, they are already there. But because of COVID, there are others that has become needy and vulnerable because of COVID. So those are the people we are reaching. So we've taken the data, we are selecting from the list which of them falls within the group that is our target. So we've taken all that, we are written, some of them we've written to them, some of them they've written to us, because we don't have to sit and say that so nobody has brought a request. We know them already and we are catching them. So through the media, if there are other categories that you can also assist us, we will be glad that, oh, we know of this, we know of this. Please, do they fall within your category? And we can always thank you and come for the data and readily go to their aid.
Okay, like you indicated, you've just now started touching the money, and I'm sure that a lot of these names will come up. So for those people who fall within that category, do they also have to call you, or there is a specific way in which they can get in touch with the organization?
Those who we've not reached yet can write.
They should write letters?
They can even call, or they can write and they will respond.
Okay,
but we are also in the process.
So how do they get to you? Is it via email? If it's an email, what's the email address? If it's a telephone number, can you share with us right now?
For now, the telephone numbers you can call 0596
0596
97 85 91 and then 0596
0596
97 85 92. We are located at the #1 Presidential Drive, Jubilee House, Point 6.
Okay, so you're around the Jubilee House?
Yes, Jubilee House, Point 6.
No, not everybody can have access to that area.
Oh.
Not everybody can have. Is that the number you just mentioned?
No, that's not the number.
Okay, the Jubilee House is not that easily accessible.
Yes, but our premises are easily accessible because of COVID-19.
So if somebody falls within the category of vulnerable, as described by the COVID Trust Fund, these are the numbers that you can call for assistance, and I'm sure that they'll do their checks when you call. That's 0596 978591.
Yes.
That's 0596 978591. You can also call 0596 978592. And don't just call because you have the number. And I mean, I know we all like money, but there are people who need this intervention, and it's a matter of life and death. We've had a show here where someone called and said and check. You can go. So when they make a call, you take details and you take the details.
You make the follow-up, and if indeed they fall within our category, the money belongs to Ghanaians. And there are voluntary contributions from individuals and groups. Although we need more, but we are there to assist. So we will assist everybody depending upon the need of the person, based on whether the person is affected by COVID, whether the person has been made vulnerable as a result of COVID, or whether that institution or group or individual is engaged in the combating of COVID-19.
Okay. Well, if you are a frontliner or you fall within this category, I mean, I know we did a story a while ago. We've actually run out of time. We did a story a while ago from the East Municipal Hospital, where the nurses there are talking about, I mean, they're saying things that could excite their lives a bit, like a live band on Sundays, Omuto, and Kia Picanto. They're ordering Uber rides, and the Uber drivers don't want to pick them up. When they get to the hospital and they hear that this is where COVID-19 patients are kept, they just drive off. Taxis don't want to bring them home.
Stigmatization.
Exactly. So that's something we're addressing. But apart from the stigmatization, they want some intervention. So
we've given them ambulance. We've given them.
But they can't ride ambulance to home. To the homes.
You are talking about providing a means of transport.
Yes. Okay. Something that perhaps the
COVID is something that can be considered.
Okay.
Yes, it's something that can be considered. If not even providing them with a dedicated bus or something, you can arrange with a transport company. Because, you know, we have to deal with the Ghana Health Service, through the Ghana Health Service, Dr. Kumar Bwaji, because we work in collaboration with them, although ours is separate.
I am making this personal appeal to you from the
So it is something that I will note, and then immediately we get back to the office, either today or Monday, we make follow-ups, deal with the management of the East Hospital, and see how best we can craft something for them, because we know it's an emergency. So if I have any contact that you will give me, I will appreciate it. But I think that my people at the office, especially Peter and Priscilla, will have the numbers, because we've dealt with them. We've given
Peter and Priscilla free shout-outs.
Yes.
So
PPEs and things that we've given them. They liaise, so they can just.
So Peter and Priscilla, please, East nurses, they said they want some entertainment. They want Omuto but most importantly, they want some
means of transport. So
yeah, no. I mean, that was they were talking about things that will excite them and things that will make them happy as they work for us. No problem. So yeah, so the COVID-19 Trust Fund, East Hospital, the Ghana COVID-19 Trust Fund says they are looking at your request carefully. Yes. We'll be here to do the follow-ups as well. Thank you very much. Unfortunately, we don't have a lot of time, and you have just started touching the money. So we'll look forward to having a lot more conversations. And I'm also inviting you, if you have any kind of explanation, contacts, interviews that you want to make, you can contact me. By all means. I will get through you to my bosses, and then a lot of them are ready to receive you, and many of the things that we've said here can be explained into details. We work together, so we thank the media. Thank you for coming. Nana Osei Bempah. Nana Osei Kwame Bempah is spokesperson for the COVID-19 Trust Fund. We've been talking about how that money is being disbursed. I'm very interested in this conversation. We'll do it again someday.